As you all know, COVID-19 numbers have increased tremendously. Today, we have a special guest. We have Dr. Mark White, who is with Gateway Health and Awareness Center. Dr. Mark White, welcome to Dalmar TV.
Good evening, and thank you for having me on this evening. It's a pleasure.
Dr. White, as you know, the numbers of COVID-19 have increased tremendously recently. Now, if I have a family member who has been tested positive, do I need to go and test myself?
Yes, well, in the event that you're living in close quarters with the family member in the same household, um, with with the way that this virus has been spread and the all of the questions surrounding there's a disproportionate of minorities that have been positive. I think it would be a good idea for you to get tested and to find out where you are in the process. Uh, Typically, if you're in contact with a person who's positive for a certain length of time, then your probability of you being contracting the virus goes up considerably. And so, in that case, I would get tested. I would definitely get tested. Hmm? I think in some cases, I don't know if I would run out right immediately and get tested. I would probably make sure the person is quarantined, isolated. I would wear the mask. I would try to keep the 6 feet of social distancing, wash my hands, all of those things that we've talked about in our communities. And I would kind of watch for symptoms. But I do think at a certain point along the way, along the time, I would go and get tested. But I would be real conscious about if I have any symptoms such as a sore throat, shortness of breath, a cough, aches and pains. So I would know that if I'm getting tested, that I'm just checking to make sure that I'm not positive yet. Because if I get tested today and I am in contact with a person who's positive, it might not show up that soon. And so that test only means that I'm not positive at that point in time. So I don't want to if I do get tested, I want to take that in the right context and understand that for this time and for right now, I'm not to COVID-19 result.
Dr. White, can someone have symptoms after 14 days being positive symptoms?
Yes, it's very important that one of the things that we want our communities to do is to do all the social distancing, make sure we're wearing the mask, make sure we're washing our hands, and even in the most perfect situations where we're doing all of the things that are recommended and suggested, a person can go past the 14 days. And so again, if we're tested positive at the end of that 14 days, especially if you're still showing signs of this COVID-19, any of the obvious signs, if you're feeling tired, if you're still with a cough and your throat is sore, definitely I would retest at that time, and if I'm still showing signs, I would continue to quarantine isolate myself until I'm symptom free, and I would continue with the same process until there were no more symptoms. And so that would mean for me to go another 2 weeks in quarantine, isolation, until those symptoms are gone, until I have at least 3 days of no fever, no shortness of breath, no cough, no muscle aches and pains. And then at that point, I would I would also get retested. I would get retested to make sure that I'm negative. And some people, there are some thoughts that within a 24-hour period, you should get tested again. So you would have two negatives. And then also consider, after discussing with your physician, getting the antibody test to confirm that you have mounted an immune response sufficient for that virus.
Now, at the beginning stage of this pandemic, the test was taking a certain amount of time. How fast the results comes back for someone's results?
So you're 100% right. It was very frustrating for I believe for providers and also for patients that were having symptoms, because the time to get the test back in some cases was anywhere from 6 to 10 days. People were just waiting and waiting and waiting. And of course, that presented a problem because a person wasn't 100% sure whether they had flu symptoms or whether they actually had COVID-19. And so I believe that once a person understands that they're positive for COVID-19, then they're going to isolate, quarantine themselves very aggressively, as opposed to not really understanding or knowing if I'm positive. I may not be as aggressive in my mask wearing, social distancing, washing hands, wiping off surfaces, and those kinds of things. So I think that the delay between the test was causing a bit of frustration on all ends. And I think even now with the city opening, what the results that we're seeing today are from depending on where a person was tested. In general, I would say that the results that we're seeing today are from probably 4 to 5 days ago. So it's not the results that we see are not live true today results. Those results are from patients that were tested 4 or 5 days ago. So we have to kind of take that. When we say if we get results and they say 450 people died today of COVID-19, a lot of us think that within the last 24 hours, those people were those were documented cases of people that were affected in the last 24 hours, when in fact, those results are coming from perhaps 4 to 5 to 6 days ago. So so you got to kind of take that delay. I think that's a really good question. You have to take that delay in the test results into consideration when you're listening to people talk about what's happened in the last 24 hours, say.
Now, most of the children are indoors, and if they stay indoors, most of the times their immune system is not going to stay the same. And if, for instance, if I have children at home and I become a positive, there's a good chance that I might my kids become positive. So my question to you is: there's been a new phenomena where the kids might develop some sort of a rash or itching within the COVID-19. Can you talk about that?
Yeah, so one of the things that one of the things that was noticed and recognized in children was that they develop a syndrome. It's called Kawasaki's disease. And in that disease, you see a very characteristic rash that comes along with that. And so, what we were seeing was kids that were positive for COVID-19 were demonstrating classic Kawasaki's type symptoms. And with that Kawasaki's disease, there's a very characteristic rash. And so in some communities, and at that point, the child would be in the hospital. And so that was a clear indication that the child was COVID-19 positive, and they were displaying symptoms, signs and symptoms at that point of the disease. And so, if you have a child and the child was to develop symptoms such as shortness of breath, fever, that's a big one, and started having a rash, then off to the hospital. That you want to have your child to the hospital and treat it in the hospital setting, as opposed to outpatient.
Now, I think there's a new way of finding out. It's called contact tracing. Can you give us more details exactly what the term contact tracing is?
Yes, and that's something that health officials are doing, health departments are doing across the country now, and and you're going to hear more and more about this contact tracing. And so I think that, of course, when we have knowledge about what's going on, we feel better about the situation. Well, contact tracing, in a situation where you have contact tracing, if a person is reported to be positive for COVID-19 to the health department, then the health department investigator, they call them staff investigators, they would contact you, and they would ask you questions about where you've been the last few days, what people you've been in contact with, all of the things that you've done, kind of trace back over your contacts and places you've been, and the people you've been in contact with. The value, there's a couple of things with that. That people shouldn't feel intimidated, or that they're being interrogated, or that they've done something wrong, or that they're going to be penalized or anything. I think that's a really big thing that I want to say in terms of this contact tracing, because we don't want people to be afraid to tell. I went to the barbershop. I went over to some friends' homes. I did, these things, and holding back the information that could potentially save a person's life. So getting back to, what that does is the investigator would ask you where you've been, who you've been in contact with, and get a lot of information about what you've done over the last 2 to 3 days. They then would also educate you in detail about what you need to do to protect yourself and keep yourself healthy. The third thing that happens in contact tracing they would then go to the people that you've been in contact with. They would not go and say, we talked to Dr. White today, and he said that he came to your barbershop, and he said that he did that. In other words, names would not be given. Your name would not be given in the conversation. The conversation would go something like this. You have been, it's been reported, a person that was diagnosed with COVID-19. They're COVID-19 positive, and they gave your name as a person that they came in contact with. And then they would, the investigator would then give you information about the things that you should do, such as wearing the mask, washing of the hands, social distancing, and in a lot of cases, this whole COVID-19 thing changes from one day to another, from one state to another. But some states and the jury's not out on exactly what Ohio is doing, but in some cases, if you've been in contact with somebody who's COVID-19 positive, you would be asked to quarantine or be not quarantine, but stay at home for 2 weeks, wear a mask, social distancing with the people in the home, and wash your hands and do all of the things that have been recommended. So that, and you would be given all the signs and symptoms from the investigator, so that if for some reason you do develop this COVID-19, you'll know you would have been educated thoroughly about what to do. You've already started taking precautions in terms of all the things that will prevent spread. And so you can see if this contact tracing is done in detail, where you can sort of have control of this disease. Because now we can anybody that is positive, we can now back ourselves into who needs to really be aware of what they're doing and aware that they've been in contact with somebody who actually has been positive. And so that person, again, I believe would take extra precaution in their goings about and what they're doing and who they're, their whole following the guideline kind of thing. And so the contact tracing, if done in detail, will be another measure of how we can offset people becoming positive with the virus.
In closing, Dr. White, what advice or recommendation do you have for our viewers?
I think that over the last couple of days, as the city has opened and people are starting to get back to their normal, trying to get back to their normal routines, I think that we all really need to understand that the coronavirus is here, and you can contract this virus still. The fact that the city's been open, people are going back to the things that they were doing. We can't forget that we've got to really wear the mask. Everybody should have a mask on. Everybody should be practicing social distancing as best they can. They should be washing hands. And also, talking to other people about it. I mean, and helping other people to understand that, this is something that we have to do as a community, as a city, as a state, if we're gonna be healthy and we're gonna survive this virus. We're gonna have to do these things. Because it's been shown that the mask, the social distancing, the washing of the hands, all of those things have worked. They've gotten us to this point. And so now that we're at this point, we can't stop doing the things that have worked. And so my prayer is that we take those things serious and we do them.
Dr. Mark White is he's at the Gateway Health and Awareness Center. Dr. White, we greatly appreciate your quality time. Thank you very much.
Thank you for having me.
Thank you. That'll be all for today's update. Thank you very much. Hopefully we'll have another time.